So, first of all, I would like to thank our sponsors. The municipality of Central Huron has sponsored this event not only this year, actually, they've sponsored us for many years. Um, and through that sponsorship, we're able to advertise this far and wide and have a bigger reach. So, thank you to the municipality of Central Huron. And we'd also like to recognize Finding Your Way and Dementia Friendly Communities, which is an initiative from the Alzheimer Society to help people with dementia and their families live safely in our communities. And without further ado, I would like to welcome our speaker tonight, Dr. Peter Lin. Dr. Lin is a primary care physician and the Director of Primary Care Initiatives at the Canadian Heart Research Centre. He has so many medical and research initiatives to his credit. But in addition to that, he is also really good at translating his research and expertise in a way that makes it possible for the rest of us to understand. So he's a sought after lecturer. He talks about diabetes, vascular protection, heart disease, aging, dementia, so many topics that we are interested in. And you can actually hear him frequently on the CBC as well. We just heard him yesterday morning. He was on the early edition in Toronto talking about Zoom meetings. And here we are on a Zoom meeting. We first heard of him when some of our staff members were at his presentation in London and came back and said, "You've got to try to get Dr. Lin here for us for Dementia 2023. He's so engaging and insightful." So we're looking forward to learning more about baby boomers and aging. And welcome, Dr. Peter Lin.
Thanks very much, Jeanette. And thanks for all your hard work of putting all these things together. It's not easy. And thank you all for tuning in. I think there's more things that you could do that is of your great interest, but thank you for your time on this. I guess it means that you've run out of Netflix things to watch if you're tuning in tonight. Anyway, so this was part of a talk that we gave to healthcare professionals, you know, nurses, doctors, and things like that. And I've kind of changed it in terms of baby boomers and aging. So we're not going to focus specifically on dementia, although many of the things that we're going to talk about will also help with dementia as well. But I thought a framework where all of us could have some benefit, things that we can do differently, may be a good idea. So let's get started. So Back to the Future. Back to the Future, and I thought I'd just share this one. This is just a funny for me, so I hope I don't offend anybody. You've got to go back to 1945, find Donald Trump's father, and give him a condom. You know, so this is the idea of going backwards in time and correcting things. And so the reason why I say that is because the baby boomers in particular are between 1946 and 1964. So that was the period of time. It was post-war. People basically... Diane is requesting decline. So basically, the baby boomers were post-war. So therefore, economy was good, life was okay, and everybody had children. And so therefore, that group of people have been growing through that whole system. So initially, we needed more, you know, sort of kindergarten kind of things. And we needed more and more of each service as these people grew up. And now many of them are now sort of the 60, 70, 80-year-old category. And so therefore now we're talking about healthcare issues, and retirement homes are going to be now booming as well. So therefore this bulge of people has really changed how our economy has been run. So this is how we used to do surgery. Okay, so I wanted to bring you back in time and talk about some of the things that are kind of crazy. This was the surgical operating room. It was a wooden table with a bit of leather sitting on top. It wasn't very sterile. These were the people that were watching and learning from this. This is the new UHN. So this is the University Health Network surgical suite now. And you can see that there's a CAT scanner in the operating room. So you can actually do the scanning, look at what's wrong, and then do the operation in the same room. So that's how high tech we've become in some of these areas. But this isn't what's going to keep us healthy, right? So ideally, we don't need the surgeries and those kinds of things. And so therefore, we have to think of ways that we can keep ourselves healthy as well. And if you look back in history, it was before it was all about infections because we had dirty water and things like that. So people had a lot of diarrheal infections, kids died very early. And when we fixed the water supply, all of a sudden people lived longer. And then what happened is this one. So, in other words, here's the Secret Service protecting President Obama, but really the threat to him is what he's eating, right? So, in other words, now we fast forward 40 or 50 years, it's not about, infectious diseases or anything like that. It's about all of these things that we're eating. And therefore, President Obama, you haven't seen him recently, but this is what he looks like on vacation. So now obesity, diabetes, high blood pressure became a big issue. Recently, with COVID-19, we revisited the infection story all over again. So you could see that these threats that come to us kind of come in cycles. And what we're doing in medicine is we try to protect people as best we can. So now we have medications for, diabetes, for cholesterol, blood pressure. We now have vaccines for viruses. We have some medications for viruses. So every time there's a new threat, we try to give you something to protect yourself. But then that's still not going to keep everybody healthy. So ultimately, it's things that we do that can maybe keep us healthy. And let me just share with you some of those things this evening. So as we age, what are the things that are changing? And more importantly, how can we stay healthy as we age? And so this is a nice little picture of sort of from crib to sort of the cane kind of scenario. And as we get older, we start collecting all these diseases. So we might have dementia, maybe stroke, cataracts in the eyes. So if you kind of go down from the top of your head all the way to your body, you can find a lot of these very common diseases that you've heard about either in yourself or in your relatives. Heart attack, so myocardial infarction, that's a heart attack. Chronic kidney disease, where the kidneys are not filtering as well. Type 2 diabetes, where the sugar control is not good. And nocturia, you're getting up to pee in the middle of the night because the prostate is big. So that's benign prostatic hypertrophy. So the prostate gland gets big. So therefore now it's difficult to pee. Peripheral arterial disease, or PAD. This is where the circulation to your legs, the pipes are now clogged up as well. And so therefore the blood flow going down to your legs is reduced. So that's where when you walk a little bit, then your calf starts to hurt because it's not getting all the oxygen that it needs. So therefore it's going to cut down on your walking. And then of course there's osteoporosis, not to be confused with osteoarthritis. So porosis means holes, so porous. So therefore, as we get older, our bones become more holy. And so therefore, instead of having this nice strong bone, we now have little holes in the bone, and that makes the bone weaker. So therefore, if we were to fall, we're more likely to have a fracture. So that's why now we do bone densities. We check on your bone to see how holy they are. Not holy this way, but holy this way. And what we do is we can have treatments for that as well. So we know that vitamin D, calcium, those kinds of things are important. We normally make vitamin D from our skin, but unfortunately in Canada, we're not walking around sort of shirtless, and there's not a whole lot of sunshine to make that vitamin D in our body. So that's why we have to take it into our system. So as we learned about these diseases, we started to give people tools to make sure that they can manage those diseases. Osteoarthritis. So this fellow might have sort of low back pain. And so therefore, this is wear and tear of your joints. And so as the bones kind of rub against each other, the nice shiny stuff gets worn out. When you open up a chicken wing, you have those nice shiny things. That's the cartilage, and it's supposed to be shiny on shiny. But then as we get older, some of that shiny cartilage gets damaged. So kind of like potholes, like our roads. And now you've sort of got rough areas rubbing against each other, and that will speed up the arthritis in those particular joints. In your back, there are little hinges, okay, from one bone to the next in your spine. These little hinges, they have that shiny stuff in there as well. And as we get older, the shiny stuff gets worn out, and therefore your back starts to hurt, and it starts to crack and make all sorts of noises and creepy sounds as well. One tip just for right now is as you're getting up, you're going to be sitting on the Zoom call for a little bit, is to move around, keep the joints moving, because when you keep the joints moving, you end up oiling up the joints. So you put this fluid in there, it's kind of like an oil, and that'll keep the joints kind of smooth, I guess, if you will. If you've been sitting for a while, before you stand up, just wiggle around, just get those joints moving a little bit, and that will get the oil going before you stand up. And the same thing when you wake up first thing in the morning, instead of trying to get out of bed right away, just wiggle around like a fish, move your hips around, move your knees around while you're lying down. And that way, again, you're oiling up the joints. And so when you're ready to get up, you don't feel like, you know, 1,000-year-old man kind of thing like I feel in the morning. So I find that that loosens things up so that that way you can get out of bed easily. And then finally, because a lot of medications are being given, right? You need something for your blood pressure, something for your cholesterol, something for your diabetes, something for your arthritis. We just have to keep an eye on all the drugs to make sure that the drugs are not sort of interacting with each other. So this one is clashing with this one. One very easy way to do that is just to stick with the same pharmacy. So if you stick with the same pharmacy, then all your drugs are in their computer, and automatically each time it's checked to make sure that there's no interaction. And if somebody gives you a new medication, it will check against all your old medications automatically and tell you if there's any problems that we have to be aware of. So keeping your medications in one pharmacy is a good idea. And you know how every time you fill your prescriptions, they always print out that little sticker that has a list of the drugs. That's a great way to have a list of your medications with the correct spelling and everything else. And so just ask the pharmacist for that. They usually throw it away because each prescription comes out with one of those things. So ask them just to give you that one. And usually on there, you've got the pharmacy name and usually the phone number as well. So therefore, if you are ever in trouble, like let's say you had to go to the hospital or you had to see another doctor somewhere, or if you're traveling, people would have all the list of medications and B, some way to contact back to your pharmacy or to your physician. The other thing that I want you to carry with you is your doctor's business card. So therefore, with those two pieces of paper, you've got your doctor's phone number and everything else. You've got the pharmacy number, and you've got a list of your medication. And I must admit, we used to play, when I was a medical student, we used to play kind of detective. So we wouldn't look at the patient, we just look at the list of drugs. And from the list of drugs, we can pretty much piece together what kind of diseases that person was having. And so therefore, by just looking at your medication, I could figure out, you know, the nurses and pharmacists and doctors can figure out what diseases you have. So therefore, they know what kind of complications you might be getting. So therefore, the drug section is actually very important for you to keep track of. And also, you should know what you're taking, right? I have a lot of patients that say, you know, I'm taking the blue pill. You know, what's the blue pill? There's a lot of blue pills. So in other words, know what the medication is for. This is for my cholesterol. This is for my blood pressure. This is for my gout or something like that. So by knowing what the medications are, then if anything slips up, like a mistake or something like that, you'll say, wait, that pill doesn't look the same. And then that way we can make sure that there's nothing falls through the cracks, so to speak. So you knowing about your medication is also very helpful as well. So how do we tackle something like this? You could see why our healthcare system is under great strain. So you keep hearing, you know, our healthcare system is broken. I don't like saying broken because it sounds terrible, because you have all these nice people working. They're not broken. It's just there's a lot of illness out there that we have to manage. So one of the things to do is to have patients aware of what their diseases are. So therefore, they become a full partner in managing those conditions. So if patients are aware of what the disease is and what they should be doing, then it's a little less burden on the pharmacists and nurses and the doctors as well. And also, if we can get the younger folks to prevent the diseases. So if grandpa had this disease, well, why don't we make sure the kids don't get that same situation? And so if we can prevent disease, then this list becomes shorter. And therefore, as people age, they will have a better sort of retirement life than just going to visit doctors all the time. So I thought I'd start off with this one, which is the Life's Essential 7. So this is from the American Heart Association, and they had put together 7 things that we should do to keep healthy. So this year they updated it. And so now they call it 8 things. So they added in one more wedge, and that wedge is sleeping. So you can see here, there's sort of diet here, that's the representation. Exercise, this is meant to represent sugar. So blood sugar levels, that's the little testing machine. Obesity, so that's your weigh scale. You can see that it's way over here. And then here is lipids, which is your cholesterol, which can clog up your arteries. And this is supposed to be a blood pressure cuff sitting over here to measure your blood pressure. And of course, smoking, and then now sleeping. So these are the 8 things that they said, if you do these 8 things well, then your chance of living longer is much higher. And so, there's no fancy stuff here. It's just straightforward stuff. So let me just take you through some of these things. So let's talk about, your diet and exercise first, because those are very important things. So we have nice pictures like this that Health Canada puts out, and they sort of say, divide your plate into, sort of half is supposed to be vegetables and things like that. Half is supposed to be your protein over here. So that's 1/4 of the circle. And then another quarter is your carbohydrates. Another way to talk about it is fists, So starches, it's 1 fistful, Meat is one of these things, the size of your palm. So you can use your hands as a way to measure how much food you're taking in. But definitely the buffet where you're piling it up like this, that's too much to go into your system, and it's very hard to get it back out. So anything that you want to use to kind of help your brain kind of figure out the proportions would be a good idea. I love this commercial. Remember the commercial, "Where's the beef?" And the reason why I put this up there, as people get older, they tend to eat less meat. And so these are lovely ladies, and basically these are called the tea and toasters. Okay, we know about them because tea is easy, toast is easy to make, whereas to make meat, it's complicated. You have to marinate it, cook it, and you have to do all sorts of things to it. So as people get older, especially if they're not within sort of a living arrangement where somebody else is looking after the meals, sometimes they don't cook a whole lot. So therefore, in medical school, they talked about these tea and toasters. Now, if you're just eating bread and tea, there's not a whole lot of nutrition in there. And so therefore you're missing meat and protein and those kinds of things. You're missing a lot of vitamins. And so therefore we might have some difficulties with health if you're not putting in the right ingredients for your body to process. I love this picture of President Obama with no teeth. So we also have a problem with people with bad teeth, or, teeth that don't fit, like the false teeth that are not working well. And what happens is that they cannot chew their food. And if they cannot chew their food, then they can't get the nutrients in. So therefore, things like meat become difficult. And a lot of times people don't want to eat pulverized meat. So therefore they just skip meat altogether. And again, we're missing food groups that way. So my dentist friend, she has this on her wall. So floss the teeth that you want to keep, don't touch the other ones. So if we're younger, then perhaps we can take better care of our teeth. And therefore, as we become senior citizens and things like that, we can continue to bring in nutrients. So that's something that we can do right now, all of us, is to look after your set of teeth as well. Now, this is what an amino acid is. And this part is going to be boring as watching grass grow. But I just want to show you what an amino acid is. So protein is made up of a bunch of amino acids hooked together like a necklace. And so the reason why I show you this is that this is the part of the amino structure. And so this top part is the same. You'll see that top part is the same. This part is different. So you could see that this one is long and straight. This one has something that sticks out. And this one has this weird looking thing over here. So the different amino acids that make up proteins are different shapes in terms of their tail. Now, the reason why that's important, you can imagine that if I put this guy and this guy together, they might push against each other, or they might be attracted to each other. So those tails might push apart, or they might attract to each other. So if I were to hook all of these things up like on a bead, so let's say I hook this amino acid and this amino acid and this amino acid, all these pieces might push against each other or attract to each other. So basically, because of that attraction or pushing away, the thing will start to fold and twist. So therefore, we can make the amino acid like one big long set of beads that are dangling. And then when we let go, the thing will start to fold, and it'll fold into a proper position, and that will be useful for us. So maybe that's the protein that makes up our skin or our hair, or maybe that's the protein that becomes an enzyme that helps with some chemical process. So this is how our body makes all these things that we need to kind of stay alive. So therefore, the amino acids dangling in the right positions is important to make sure that the folding is in the right position as well. And so we can fold all sorts of wonderful things. I don't know how to make this origami stuff, but if we can get the proteins to fold just right, then we can make all sorts of different things that we need within our body. And we can make scissors. These are called enzymes, cutting scissors. So they're not exactly like scissors like this, but these are proteins that can cut chemicals. So they can break down chemicals for you. And then therefore you can absorb the nutrients. We can make things that are like receptors or chemicals that can communicate with each other. And so therefore these proteins can now become very useful for us if we can make the right types of proteins. The problem is that we need many of these amino acids. So each one of these is the amino acid. And these ones are essential, meaning we have to eat them in. So the only way to get these particular little chains and beads is to eat it in. So let's say I'm just doing tea and toast and I'm not eating a lot of meat. I might be missing some of these. So let's say I'm missing this one and missing this one. Let's just say you're missing two of them. So now when you try to make the necklace, if it's missing that one, then you're just going to substitute another one in there. But the substitute won't be the right chain, right? It won't be the right pushing and all that kind of stuff. So what ends up happening is that now you make that nice necklace, but in these spots, you've now substituted a different amino acid in there. And let's say the other one is in these spots, you've substituted something else in there. So that means the pushing and pulling is going to be different. And that means the folding of the protein might look very different than what we were expecting before. So now this protein might not be normal looking, and maybe it's not going to do the right thing. And so that's why eating all the essential amino acids is so important, so that you can build all the right tools that your body needs to happen. And I'll give you a very concrete example. So we know about sunshine can damage your skin, right? And we know that it can damage the DNA, your blueprints on how you make cells. So let's say it damages it. Our body is able to repair it. Just like if you get a ding in your car, you go to the body shop and they pull it back out for you. So in our case, when radiation from the sun damages the DNA here, so now it's messed it up in this particular area, we actually have a little pair of scissors that come and cuts out that part that's damaged and then replaces it with another piece. It's kind of like taking, the hole and then putting a new piece of drywall in there, and then it can actually seal it up, and then now you're back to normal. Now, unfortunately, these pairs of scissors are made from proteins that we just talked about. So therefore, if let's say you're not eating a lot of protein and you cannot make this pair of scissors, or your pair of scissors is kind of not working, it's kind of twisted a little bit, then you cannot cut that bad piece out. And if you cannot cut that bad piece out, then you do not do the repair process and you do not get back to normal. So therefore, you will have damage in that area that you cannot repair. And if we keep collecting damage after damage after damage, then do those cells now become cancerous, for example? And so therefore, by not repairing the thing, we now lead down to a bad path of disease. And so that's why the nutritional side is so important. And we make sure that everybody is getting all the materials that they need to build all of these particular enzymes. So let's say you're supposed to build something that looks beautiful like this, but instead your proteins are folding funny and they get crumpled up like this. So now this crumple is not going to be useful for you. In fact, we've now figured out that some of these bad proteins that we're making might end up getting stuck. And you've heard about this in Alzheimer's disease. In Alzheimer's disease, you see amyloid plaques getting stuck in the head. And that amyloid is not the right length. So normally we cut it and it's this long. But unfortunately, in patients with Alzheimer's disease, the pair of scissors is cutting it at the wrong spot. And when it cuts it at the wrong spot, these proteins stick together and they make this clumpy thing, and then it clogs up in the brain area. So it's almost like garbage building up around all your brain cells. So that's why we think that the nutritional side of things is just very important. And it's relatively easy, right? Every single person can have good nutrition. I understand the cost is kind of going crazy these days, but at least it's not like a medication that we have to give every single person. It's something that we can all have access to, making sure that we're getting in the right nutrients for our body. So that's why the diet part is so important. What about the exercise part? I think that's important as well. And if you look in areas like they're called the blue zones. I think you might have heard about these folks. It was a guy from the National Geographic, and basically he said, let's go look at places where people live to 100. And these are the places where people live to 100. Like they're all over the place. They're not related to each other. And when he went to these areas, and they were called blue zones because he used a blue marker to circle these areas. That's why they're called blue zones. So there's nothing magical about the color blue. And so when he visited these places, he noticed something interesting. There's no smoking in these places, so they don't do that. And they're very active people. So when they started looking at these people, like at the age of 80, 90, they're still like busy farming, doing stuff together, like community. They're fixing things, they're fixing fences. And this guy was very funny. The reporter, the National Geographic guy said, why are you fixing the fence? And the guy said, because it's broken. Like he thought, like, are you stupid? Kind of thing. So here's a 90-year-old man fixing a fence, and it seemed very natural and normal to him. And you could see them doing these crazy handstands and diving into pools. So there's no formal gym. In other words, they don't join a gym and do an hour of exercise every single day, that kind of thing. That one we sort of made up because we wanted to get people to get moving. But now we're understanding that instead of doing the hour of exercise, why don't we just keep moving? So if you keep moving, then your muscles are on all the time. You're burning fuel all the time. So therefore, you're not going to be as fat, and everything else improves. And as you're moving, the joints are getting oiled up, and therefore the joints stay well as well. So it's this sort of movement around that's actually the important thing. And if, let's say, you're at a job where you have to be on a computer, slide your feet around on underneath the table, like on the floor, slide your feet around, wiggle around your back, just keep the joints moving, keep the muscles on, and that would be healthy for you. So instead of going for the half an hour intensive therapy or gym, let's just keep moving throughout the day. And that's what these people do. And they live a good long life. And also community, sort of support is very helpful as well. So let's go look at these four. Now, these four, you see doctors all the time, diabetes and obesity and cholesterol and blood pressure. And so this is really what happens in a heart attack or a stroke. And this is what we're all afraid of, is this big blood clot plugs everything up. So why do we get that? Well, the first thing is that there's blood pressure issues. So if you have high blood pressure, then these walls are going to be damaged. So the pipe is going to get hit with this pressure. And so the lining of this wall gets damaged. And then now cholesterol can go into the wall, and then it gets stuck in the wall, and then it starts to fill inside the wall. And now all of a sudden this space becomes very small. Now, every so often there's some inflammation here, and then this thing ruptures. So it cracks, and then it's now an open sore, kind of like when you have a cut. And now if you have an open sore here, then your body will form a little blood clot for you. And if it's a tiny blood clot, no big deal. But if this little blood clot becomes a big blood clot, then it plugs up the whole pipe. And now there's no blood flow going to whatever organ it is. So let's say it's going to your heart, then this would be a heart attack. If that pipe is going to your head, then that would be a stroke, for example. And so therefore, this is the disease process that we worry about. We then started to learn about this blood clot. We can give you aspirin, for example, and then that would thin the blood so you don't make the blood clot. So we started to figure out how to affect this process so that way you don't get the bad things. We also learned that sugar will cause problems inside the pipe. So diabetes became an important issue. And we realized that inflammation in your body. So if you have arthritis, like inflamed joints, like rheumatoid arthritis, you're at increased risk of this thing rupturing. If you have an infection like flu, COVID, or pneumonia, you're at increased risk of having those plaques rupture because there's inflammation, those plaques become active, and then you form these blood clots and things like that. So we started saying that maybe we should vaccinate people so that we make sure that they don't get the infection, they don't get that inflammation. Also, having a big belly increases inflammation as well. So the fat cells inside your belly produces chemicals that causes inflammation and more likely to have heart attacks and strokes as well. So therefore, controlling your belly weight is very important too. So we don't want a big belly. We don't want you to have high cholesterol. We don't want you to have high sugars, and we don't want you to have high blood pressure. So this became the reason why we gave all these pills to people to try and protect them. And if we're to look at blood pressure, you could think that blood pressure will affect every pipe in your body, right? So all the red ones are the arteries, the blue ones are the veins bringing the blood backwards. So you could see that if I have high pressure in all those pipes, I can affect your head, your heart, your kidneys, everything, your legs. And so that's why we can have all these diseases just coming from having high blood pressure. So that's why it's so important to treat the blood pressure well so that we don't damage the inside of the pipes. And if your heart has to pump against that high pressure, well, then the heart muscle is going to get into trouble as well. And you can lead to heart failure, and you can lead to funny electrical things because we have an electrical system in your heart that tells it when to beat. But if the heart is beating very hard against this pressure, the chambers become stressed out and enlarged. And as they become enlarged, they can stretch those wires, and then that screws up the electrical system as well. So that's why treating blood pressure would be really good to avoid all of these complications. And if you look at the difference in blood pressure, let's say it's 140. So normally we like to see it less than 140 for everybody. 120 is perfect as the big blood pressure. That's the one when the heart is squeezing. So when the heart is squeezing, that's the top pressure. When the heart is not squeezing, that's the lower number. So that's why they always give you two numbers, 120, 80. So 120 is when the heart is pumping. 80 is when the heart is not pumping and it's just stationary. But if you look at the risk of dying, for example, from a stroke, it depends on your age. So in other words, a 140 blood pressure for a younger person, this is the risk of dying. And then for an older person, this is the risk of dying. So therefore, exactly the same blood pressure, but an older person, it carries higher risk. And so therefore, we have to protect people. And this is the top number that we're talking about. And this is the diastolic pressure, the second number that we're talking about. And the same thing. So let's say 90. If you're a younger person, you have less risk than an older person that would have higher risk. So that's why even if they're older, we still should pay attention to their blood pressure as well. And this is looking at as your blood pressure goes up, your risk of dying also goes up. And so that's why early on we decided let's lower the blood pressure and see if we can do the reverse of this. So that's where we started with all these blood pressure medications that we get people to take. And that's why we want them to take it, because we're trying to lower the risk of dying. And you can imagine that the blood pressure is pounding inside. It's like a little jackhammer going. And so therefore, if let's say it was 150, so that's very high, that's a lot above 120. And you can see that if your heart beats 60 times a minute in 24 hours, you'll get 1,400 hits of high pressure per day. And then if you do that for a year, it's 500,000 hits on that poor little pipes that are happening. So therefore, if we could treat it now, that would be a good idea and keep that blood pressure down. So if you know anybody that's taking blood pressure pills, just tell them, please keep taking it every day. And please measure once in a while to make sure that your blood pressure is doing well. This is how we used to diagnose diabetes. We used to get people to pee on a rock. And if the ants came, then we know that there was sugar, and that's how we diagnose diabetes. We don't have to do that anymore, but we know that sugar sticks to places. Okay, so sugar inside your blood vessel, there are little proteins that hang off, and sugar will stick to that particular protein. And that sticking will cause damage to the pipe so that it cannot function anymore. So if it happens in your eye, the little blood vessels in your eye, then it's going to mess up your vision. If it happens in your heart, then it's going to mess up the circulation going to your heart, so you're more likely to have a heart attack. And if it's in your kidneys, it's going to mess up the circulation in the kidney, and then your kidneys might not work as well. And if it happens in your toes, then your toes won't get blood flow. And then the toes, you've heard about these gangrene toes and things like that. So you could see that sugar sticking in places would also be a bad thing. And so that's why we try to avoid it. And this is what kind of sugar sticking will do. So you could see here, this pipe is not bad, but this one is all messed up. So what happens when it sticks, it makes the blood vessels weaker, and then it kind of leaks. And that's the leaking, that's the bleeding in the back of the eye in a person with diabetes. So that damage is done, but we can protect this area. So that's why we try to treat diabetes, get the sugar down so there's less sugar sticking, and therefore there's less damage coming in that direction. So some of you, if you have diabetes, you'll know that we measure something called A1C, hemoglobin A1C. And what is that? That's sugar sticking to your blood. So your hemoglobin is a protein. So therefore, sugar will stick to that. I can measure that with a blood test. I can't measure sugar sticking in your eye, but the sugar sticking onto your blood will tell me, do you have a lot of sugar sticking in your eye? And so what happens is that we measure all your blood, and we say, what percentage of your blood has sugar stuck to? And that will give us a sense. Normal should be 6% or less. So let's say you came back at 10%. That means you have a lot more sugar sticking to your red blood cells or your hemoglobin. And that means there's more sugar sticking in the eye and your heart and your kidneys. So that's why we use that number a lot to figure out, is the diabetes under good control or not? Now, these little red blood cells will die every 120 days. The red blood cells die. And that's important because once the sugar sticks, it does not unstick. So we have to wait for that red blood cell to die. and a new one comes out, and then we see the sugar sticking again. So then we can see, are you doing a good job? Is there less sugar to stick around, etc. And so what we measure is sort of stick, 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 and the red blood cell dies, stick, 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 so the red blood cell dies. So the A1C is sort of measuring what's happening in the next, 4 or 5 months kind of thing as to how much sugar is sitting there. However, on the back of your eye, the sugar just keeps sticking. So the damage is kind of continuously going up because the back of your eye doesn't have a new back of the eye. The red blood cells, you get new ones, but the back of the eye, you don't. So that's why we don't like to see this A1C at a very high level, because once the sugar sticks to the back of the eye, it does not unstick. So that's why earlier control will be better for our patients with diabetes. And so controlling that sugar is good. So if you have patients or your family members or yourself that has diabetes, we want to see that number sort of down in the closer to the normal area so that you don't have all this sugar sticking in the eye. You'll hear about these fancy devices you can wear in your skin, and they're measuring your sugar in your skin. And so that you can give these beautiful readings and stuff like that. And so you could get things like this. So before we used to do the finger poke, right? We poke your finger and we see what the sugar is. And so let's say this is the normal range. And let's say I poked your finger here and then here and then here. This looks pretty good. You're in the green section. But what happens is that hypos means low sugar. So we don't see any low sugars, and hyper means high sugars. So you could see that this person using our old way of doing it, fantastic. However, the sugar, what's happening to the sugar in between? It could look something like this, for example. So yeah, these points are great, but here we have areas that you are too low, and here we have areas that are too high. So in other words, poking your finger once in a while doesn't give you a picture of the whole thing. And so now we have those funny devices that some of you might have known, where they can measure a whole bunch of recordings and they show you what happens throughout the day. And so now we can say, this is the low area where you have low sugar. This is the good area where we want you to be. And this is the area where it's too high. And so we can say, hey, what did you do over here? Oh, I had lunch, I had breakfast. So we can figure out why your sugars are going up. And just to make it very easy, they actually show you in a little graph called time in range. How much time do you spend in the good area? And we can report that back to you. How much time do you spend too low? How much time do you spend too high? Okay. So in other words, for those that are using these devices, we can tell you of the day, 70% is spent in the right area, 2% is spent in the other area. I'm sure your boss will want to do this in terms of how you work as well. But for now, it's just your sugars that they're measuring. And so some of you might be able to use this to say, okay, I have a problem because lunchtime is really bad for me. Like it just goes crazy. Oh, let's talk about what you're eating at lunch, and when are you taking the medications? When are you taking the shots? So we can figure out things a whole lot better with a little bit of technology help. So let's go after these ones here. So we've got these ones done and we've done these ones. What about smoking and sleep? So smoking, this is great. This is a picture of smoke. And people always laugh at me. They go, Peter, you're so mean. She wasn't born this way, like as a smoker. Yeah, actually she was. This is, her as a kid, with a cigarette butt. So in other words, cigarette smoking is a problem because you're breathing in a lot of chemicals into your lungs directly. And you know how we talked about, forest fires and stuff like that. We don't like to breathe in chemicals into our body. And with a cigarette, you're lighting a fire and then you're breathing it in. And you remember the forest fires, they were horrible. This is in British Columbia, compliments of BNN. And so you could see all that black smoke. These are particles. When you have a very good fire, a clean fire, you should get water and you should get carbon dioxide. There is no smoke. So when I was a Boy Scout, we used to make these, TP kind of fires. And if the fire has a lot of oxygen, all you'll get is water and carbon dioxide. There's no smoke. When you see smoke like that, it means that there are chemicals being created and it's not burning all the way to water and carbon dioxide. And those little chemicals get in the air and they can float around quite far. And here's a picture of New York City from all of the smoke that was coming from us. And so you can have different size particles, and these are sort of measured in microns. And so these are very, very tiny particles. And you could see 10 microns. Where would that go if you breathed it in? It wouldn't go very far in your lungs. It's just in the big tubes that it would get to. But if you now get to the 2.5 size, you can now get them into your lungs. So now those particles will get into your lungs. And if you get them really tiny, your whole lung will be filled up with these things. And if you get them really, really tiny, they can now go into your bloodstream as well. And the reason why that's important is that if you have some chemical in your body, your army will try to get rid of it. But then it's going to think that it's alive and it's going to attack it. So it's going to put chemicals and all sorts of crazy stuff to try and kill it because it thinks it's alive, like it's an infection of some sort. But it's just a chemical. So it just sits there, does nothing. And all those chemicals that your body pours on top is not able to kill it because it's just a chemical. So your body keeps pouring more chemicals on there, and that causes inflammation, like a fire in the area. So you can imagine if I breathe these little particles in, it's going to cause my body to attack those little particles. They don't go away. So I'm going to keep attacking. So therefore, there's going to be fire. There's going to be war in my lungs. And if I can get it into your bloodstream, the same thing will happen there. Your army cells will see this stuff in your bloodstream and say, this is something foreign. I'm going to attack it. So now you have inflammation in your bloodstream as well. And there is some talk about how some of these things can get into the brain. And if it goes into the brain and your army in the brain starts saying, oh, there's something strange here, let's attack it, then now we can have inflammation around your brain cells, and that would be harmful for your brain cells. So that's why we're very nervous about these sort of fires that people are breathing in, and in particular smoking and breathing it in is even worse because it's directly in front of you. So if we can get rid of smoking, I think that would be very good. And on those smoky days with the forest fires, if we can stay indoors is better. If you have to go outdoors, the mask will be helpful. And indoors, if you have a HEPA filter to clean the air, that's also helpful as well. The reason why we think about this is what your lung normally looks like. There's a lot of elastic tissue in your lung. It's like a balloon, with lots of little elastic bands all over the place, sort of keeping the lung together. When we pour all those chemicals to try and clean up when we try to defend against the chemicals, when we pour all those things to try and get rid of it, we end up making damage to our lungs. And so now you can see there's no more elastic bands. You're just left with little holes. And so the lungs become very different looking. So this is what a normal lung looks like from the side. And the way we breathe is now going to be very different as well. So when we normally breathe, we have the diaphragm. Okay, so the diaphragm has a little hard part, and then it has some muscle that comes downward this way. And when this muscle contracts and tightens up, this little dome now becomes flat. And so because it's coming downward, it's now made this space bigger. So this space is bigger, so now air will come rushing in to fill up the space. That's how you breathe in. When that little dome pops back up, then basically it's going to make that space smaller, and then now you're going to push the air out. So that's basically how we breathe. But if your lungs look like this, okay, because of all the damage, it doesn't look like this anymore. It looks like the following. This is what a smoker's lungs look like. It's all filled with air because all the elastic bands are missing. And so now, instead of having a nice dome, this thing now is flat. And so that's a problem because when that thing contracts and pulls, it's not changing shape. So it's not going from this to this. And so therefore people get into trouble. They can't breathe. And so therefore these people with the smoker's lung end up having to use their neck muscles to pull up the lung to help them breathe, and they use the rib muscles to squeeze down tight. So therefore, it's very difficult to breathe in that fashion. And for fun, I wanted to try and get you guys all to breathe online with me, like a person with these smoker's lungs. And so I was going to get you to suck in a straw, but I don't think that's a good idea. So here's what I want you to do. I want you to take a big breath in, and we're going to flatten out your diaphragm. So a big breath in, and your diaphragm will be flat. And then I want you to try and breathe there. Okay. So big breath in, and then try to breathe with a flat diaphragm. Now, initially, I can't see you, but then initially you're just going to hold your breath. And then afterwards, you're going to need to breathe, and you're going to be jiggling around, and then it becomes very uncomfortable. So therefore, okay, everybody can stop breathing. I don't want anybody turning purple or anything like that. So in other words, if we can get rid of smoking, then we don't get this COPD or this smoker's lungs, and people are going to live longer. And so that's one thing that we can do. So if we can get rid of smoking, that would be a really good thing. And that's why some countries are saying, let's ban smoking, altogether, to try and, save the population. There are things that you can do to assess smokers. Like if you have a smoker, you can ask them these questions, like how bad is your breathing? And the one I want to point you to is this one. You walk slower than people of your same age. So you walk slower than your friends. That's a bad sign for your lungs. Or if you have no friends, or if you're walking by yourself, if you have to stop to catch your breath, that's a bad sign. So that means that you have moderate COPD, moderate smoker's lungs, and those people need special attention from their doctors, special medications and puffers and things like that. So you can quickly assess somebody like this and see if they're in trouble or not. And then that way we can, again, help them. The goal is to identify people and then help them. So therefore, smoking is done. What about sleeping? Okay, so sleeping is a big one. I love sleeping and I don't get enough of it. And so this is not good sleeping, but we see a lot of people doing that, sleeping in chairs and stuff like that because they're exhausted with all the days. And that's going to be a problem because their sleep time has become shortened. And for some reason, we think that sleeping is not important, right? We can cut into it. And it turns out sleeping is when you do flushing. So during the day, your brain cells are working a lot and they create a lot of chemicals and waste. It's kind of like, think of a restaurant, in the daytime, the chefs are going crazy. There's a lot of garbage being created. And then you need nighttime to get rid of the garbage. That happens in our brain as well. During the daytime, your brain is busy processing everything that you're looking at, hearing. So therefore, there's a lot of garbage being built up. At nighttime, it has to flush all the way out. So it turns out that there is a washing process that happens, not exactly like this, but it turns out these are rat brains that they're looking at. And you could see these little blue channels, okay? So our brain actually floats in some liquid. For those of you that know about this stuff, remember high school anatomy, cerebral spinal fluid is the liquid that our brain is floating in. And we just thought it was just for shock absorbing and that kind of thing. But now we realize that at nighttime when you're sleeping, channels open up in your brain and that cerebral spinal fluid goes in and it flushes out all the garbage. And so this is rat brain. And so CSF flushing. And so the more sleep you get, the more flushing you will get. And they were saying that on estimate, you need about 6 hours of flushing in order to get rid of all the garbage. If you don't flush, then tomorrow morning, your restaurant will still have garbage in the kitchen. So therefore, you won't be thinking as fast. You'll be cluttered. You won't be able to, you'll make mistakes. And we've all had that when we don't get good night's sleep. And the more horizontal you sleep, the better the flushing. And it makes sense, right? So this lady's sitting upward. It's very hard to flush upward. So therefore, there is no flushing when you're sitting on an airplane flying, or if you're sitting on a lazy boy. Your flushing ability is going to be reduced. So therefore, if let's say you have bad heart failure and therefore you can't lie flat because you have a difficult time breathing, that becomes a problem because you're now sitting propped up and the flushing of the brain might not be so good. So let's go and try and figure out heart failure, avoid heart failure or treat the heart failure better so that we can lie as close to flat as possible. And when you sleep, don't sleep on your desk, don't sleep in the sofa. Go down and lie down in a bed and properly sleep so that you can flush out all that garbage. Oh, this one is the snoring. You could see her face. So both of them have sleep problems now. And that obstructive sleep apnea where you have blockage of your airway. What's happening is that here's your tongue. So this is a side view of you. So this is your tongue right there. And so this is your windpipe back here. Okay, so you'll see that the tongue should not be blocking the windpipe. In people that have snoring and those kinds of things, what you see here is that the tongue is actually blocking off the windpipe. So now there's no air going in. Now, if you're watching somebody sleep, what you'll notice is that they stop breathing. So a lot of people will say, yeah, he stopped breathing. And then what happens is that the oxygen goes down and the bad air increases in your body and your brain's going, what's going on? Your brain wakes up and it pulls the tongue forward and then air starts to move. And so people will say, yeah, he stopped breathing. And then all of a sudden there was air going through again. And so that's basically the sleep apnea. So if you see that happening in your spouse, then they should go get a sleep study done and to see if they're actually plugging up. Because you can imagine plugging up is not good. No oxygen, you don't exchange air. So you're basically suffocating, for those 5 seconds or 10 seconds. And so that's not good for your body because your body all of a sudden says there's no oxygen, there's no carbon dioxide removal. And now every system is affected. And so that's why when we look at people, you can actually look in the throat. So this person, no big deal, right? Because the space is quite big. This person, you can see it's starting to kind of come down, and you can imagine the tongue might block that off. And you can see this one, it's pretty bad. So just looking at the back of your throat, you can figure it out. But definitely, if somebody's with you and monitoring, they can see it. There's some apps as well that can monitor as well to see whether you're stopping breathing as well. So some of those apps, don't pay for them. Just use the free trial for 2 weeks, and you already figured out whether you have problems. And this slide is actually an older slide, but they said, what happens if you have this apnea? And apnea just means no breathing. So basically, all the gases are going in the wrong direction. And these are all the horrible things that happen. And then these are the results of it. You get heart failure, you get heart attacks, those kinds of things. And so you could see that there's a lot of things that happen when you don't have oxygen coming into your system. So when they looked at people and they said, well, let's give them a machine to blow air down. So that's what a CPAP machine is. Do they do better? So if we leave them alone, this is bad obstructive sleep apnea. So this is untreated. This is sort of the events that they have. So they have a lot of events, heart attacks and strokes like that. If you give them the CPAP, which is the machine to blow air down into your throat, you can see their risk is dropped dramatically, so that they don't have to have all those events. And if you're comparing it to just a snorer is actually not bad. So if they just snore, they're still getting air in and out. It's when they stop breathing, that's the bad one, okay? And then here is other events that they're looking at. And again, you can see severe people, and then the people that got the machine, you can see this drop as well. So therefore, for people where their breathing actually stops in the middle of the night, then getting the machine can reduce their risk of having heart attacks and strokes and even dying. So therefore, again, something that we can help people with. So therefore, sleep is now very important. So these essential 8 is very simple. I love this one. I'm getting nothing. So what about other things that we should do? So those 8 things we should do for sure. What about the 5 senses? So now they're saying that if we can keep the eyes and the hearing going, that would be very useful for people with Alzheimer's disease, to prevent Alzheimer's disease or to prevent sort of brain shrinkage, because we want to use the brain. So if your eyes are working well and your ears are good, signals are going to come in, the brain is going to be stimulated. So those circuits you will keep. So this is a funny eye picture. So we don't want this scenario. So things like cataract, glaucoma, diabetic retinopathy, the sugar sticking in your eyes, and then macular edema, swelling in the back of the eye. So what we want to do is we want to catch these things early so that way we still keep the vision very nice. Cataracts is easy, right? You do the cataract surgery and you can see. Glaucoma is pressure. It's too much pressure pushing on the back of your eye. And if you don't treat that pressure, it'll kill the nerves in the back of the eye. So that's why getting your pressures measured is important. Treating the diabetes is important. And this macular edema is the fluid swelling. And this is a very simple test. It's called the Ansler's grid. It's just a bunch of straight lines, and you get people to look at it. So in you and I, if the back of the eye is normal, you'll see straight lines. But imagine if the back of the eye has fluid behind it. So in other words, swelling. So if I swell up the back of the eye, these lines are not going to be straight anymore. And so that way, normal person, this is somebody with the edema, the swelling in the back of the eye, and they will tell you that the lines are not straight. And then this is a much worse version, and this is a much worse version. And the top part is what the person would see. So if they were looking out, there's areas that they can't see well. But if you show them the grid, they will say that the lines are all wavy. So it's a very quick screening test that you could do. If you want to check where people can see, like are they missing a chunk here or not, just show them a calendar, right? And just tell me what numbers can you see. And so if they can only see the bottom section or these ones, they'll just tell you the numbers. So showing them a calendar is a very easy way to see if certain sections of your vision is gone or not. We all do this. I'm guilty of it as well. So myopia, that's nearsightedness. We all have phones very close. So it's making our eyeballs work closely. So now we're having difficult time looking far away. And so we were designed to look far away as hunters, right? And so now we're staring at things that are like only 5 inches away from your face. So please limit that. You'll still use it, but just don't do it so often, because I've noticed that if you do it for a long time, you look up, everything is fuzzy, you can't focus. So therefore, just don't spend so much time staring at the screen, and make sure the screen is further away. And we've never actually had, retinal detachment, by the way. Nearsighted people are more likely to have the back screen, the retina, fall down. So if you ever see like a black curtain or flashing lights, it means that the screen is pulling away and falling down. So that's a retinal detachment, and that is an emergency. So that's one where you just go straight to the emergency department. You tell them that I have a black curtain falling down. I think the back of the retina has fallen down. And that's something that they can fix. If you get in there quickly, they can use, things to kind of put back the screen, I guess, if you will. So that's something that we should keep in mind. That one we should not wait on. The other thing is that near UV exposure. So we have this bright light, and we've never stared at a sunlight before, right? You think about it, you don't stare at the sun, right? That's going to burn your eyes out. And yet with these phones, it's a super bright light. And some of the light is like that blue light, that UV light. So it's close to what comes out of the sun. And so now you're staring at it. And that's very unusual. And that causes a lot of eye strain and everything else. So try to either use the night version. So they have some that are night version, which is like the screen is kind of black, or it's kind of orangey color, so it's not as bright on your eyes. So maybe that will help save our eyes as well. And to prevent against cataract, you can wear sunglasses that block off UVA and UVB light, so that'll be less damage to your lenses. So for your kids, so let's say grandpa has cataract, then for the kids, let's make sure they have sunglasses when they're outside so they don't get that same problem. Hearing aids, okay, this is the old hearing aid, I think is important. I'm not sure if you want to hear all the time. There might be a lot of noise that you want to hear, but they notice that people that don't have good hearing end up becoming more isolated, and their brain function goes down. So therefore, hearing aids may actually increase the connectivity. So people are more likely to talk to them. They're more likely to talk back, in which case their brain function would be better as well. This one I just put in because all my patients are preoccupied with their poop. And so therefore, this is the Bristol stool chart. So you can actually look at it and say, my poo is a number 4, And I have a lot of patients that say, I wish it was a number 4 like a banana, but mine is more like a number 1, these little pellets. And by using this, we can figure out, are you constipated, not enough water, not enough fiber? So this is something useful to kind of get used to, because we want your bowels to be working, because that's your biggest factory, is your intestine in your body, because it has to get all the nutrients out of your food, and then it has to get rid of waste product as well. So that's a huge factory, a huge assembly line. And so therefore we want the bacteria in your assembly line, that microbiome, to be very healthy, because you and I can only process some of the food that we eat. We actually need the bacteria to help us do the rest. To give you an idea, in our body, this is how many cells we have, 10 trillion cells. Mainly it's the red blood cells. The number of bacteria that we carry with us is 100 trillion. So 10 times the number of cells that we have is what we carry with us in bacteria form. And the reason is because our genes, our DNA, our blueprints, we have 20,000 genes. So let's say we can make 20,000 enzymes that can help you process food. Let's say it's 20,000. The bacteria carry 3.3 million genes. So they have way more enzymes that can help you do these chemical reactions to process our food. So that's why we need these bacteria to help us process our food, so that we can absorb all the nutrients and vitamins and everything else. So that's why, the bacteria, we need to keep them. And in our bowel, we have about 1,000 different bacteria types. And so we would like to keep the variety out there. And so let's say you only eat meat, then you're going to lose some of those bacteria that you're not using. So that's why we like to keep your food, a variety of food, so that way we can have a variety of bacteria to help you continue. And this is also why we don't want to use too many antibiotics. So we don't want antibiotics in your chicken. We don't want you taking too many antibiotics, because we might end up killing some of the good guys that are processing off all your food as well. What about vaccination? I think we've heard enough about vaccination. As we get older, our training ground is not as good for our immune cells. So you guys have heard about T cells, right? These are the ones that can kill off infected cells, and they're also memory cells. They remember, and then they can trigger, a reaction later on. And it turns out your bone marrow makes the T cells, but the T cells go for training camp in the thymus. And the thymus is a gland that sits right here underneath your breastbone. And it's kind of like Harry Potter going to Hogwarts to get trained. That's basically what happens. And these T cells basically get trained to figure out what to recognize. So what is the new threat? So they make these receptors, and the receptors can find, different bacteria. So in the training center, they're mixing and matching and creating new receptors so that they can attach and protect you against different invaders. As we get older, the thymus becomes replaced by fat. Everything gets replaced by fat, but the thymus gets replaced by fat. So Hogwarts is no longer training the T cells. And so you're still making T cells, but they're not being trained. And so that's why as we get older, our immune system is not as good. We can't move as quickly. We can't defend against many different things. And even when we give you a vaccine, it may not work as well. However, because your immune system is not as good, we need a head start. So that's why vaccinating is sort of like seniors for flu shots and all these different shots that we're taking, because we need to give your body a heads up and say, this is what it looks like. And instead of you doing the training camp and figuring it out, we're just going to show you what it is. Okay, this is the bad guy, and make the antibodies against this bad guy. And so that's why in the elderly population, the vaccination became so important, because we can protect them so that they don't get the disease when the virus actually comes or the bacteria actually comes. Oh, this is a peeing. I'm not sure if this is a great picture of peeing. So what about kidneys? And I mentioned kidneys because kidneys never complain. You know, when was the last time you said my kidneys are complaining? Never. So kidneys never complain. So we have to go looking to see whether they're okay or not. Because by the time there's kidney disease kind of symptoms, like where you swell up and stuff, like the kidneys are really messed up. So the kidneys are very good workers. They never complain, even when they're failing. So we have to do some tests. So one test is called the EGFR. And basically, I want you to think about this as speed. How fast is the kidney filtering out garbage, like this assembly line? How fast are they getting rid of the garbage? And we like to see that number above 60. You know, higher the better, but above 60 at least. So if you're a 35 EGFR or a 30 EGFR, that means you're at half the speed. So EGFR is the measurement of speed. You're going to see another number called albumin creatinine ratio in your urine. So in your pee, we measure how much albumin you have and how much creatinine you have, and we compare. Why is that? That's measuring quality. How good is your kidney? Because a good filter should get rid of garbage, but it should keep the good stuff inside, right? So good stuff is albumin. That's a protein. We want to keep that inside. The garbage is creatinine. That's a waste product of muscle breakdown. So that is garbage. We like to see that one go out. So in a perfect kidney, you get lots of the garbage going out, but the good guys stay inside. So if we're looking at the amount of albumin to creatinine ratio, it would be very low because you don't have any of the good guys coming out. And so therefore, in this case, ACR, a low number, is a good thing because it means the good guys not coming out. On the other hand, if a ton of the albumin is coming out as well, that's no good. So if you compare this to this, you now have a number that will be higher. And so therefore, that's bad. So therefore, those two numbers will tell us how is your kidney. And because the kidney never complains, we have to go check in on it. So if your doctor didn't do it, you might say, hey, how's my kidneys doing? And then that'll prompt us, okay, we should measure these things as well. Well, I like this picture. A family history is very important. In other words, look back at the family history and then you can figure out what diseases you might get. So let's say you look like Uncle James. Then basically if he got heart attack and stroke, there's a good chance you might have it as well, right? So therefore looking back at the family history is useful because it gives us a heads up as to what to look out for. For Alzheimer's disease, it is true if you have one parent with Alzheimer's disease, that increases your risk. If you have two parents, it increases your risk even further. So therefore, counting the number of people that have that condition is also very useful. We've also found people where, suddenly they had young people dying. So if you have some people that says, yeah, the guy was 27 and he died suddenly, we will worry about, is there something wrong with the heart, that they would suddenly die. And we've been able to find people that have these funny rhythm problems. And if you find these funny young people deaths suddenly with no good explanation, it may be these rhythm things. So we can identify these people and then we can protect the rest of the family because we now know the family history as well. I think this is a fun picture. I have to swear, I have to use profanity here. So this ostrich is going to say this, right? Because basically it's running for its life. And the reason why I show you this is that this is the fight or flight response, and it's meant to be on and off. We have that same response in our body. So when we're in danger, we're going to be running and, your heart is going to be beating fast because it knows that you need to get out of trouble. So in nature, the system was meant to be up and then down. In other words, on and off. In 2 minutes, you're either still alive, in which case you don't need the system to be on, or if you're not alive, you're dead, in which case the system is off already. So it was meant to be just on and off. However, we have different lives now, right? So looking at this couple and this person, I think it looks more like this. Okay. So this guy is no longer on and off. It's more like from the moment you wake up, there is this fight or flight system. You're stressed already. And then on top of that, you get more stress, right? As you go through your day. So now the system that was designed just to be on or off is now on most of the time. And on top of that, you're getting these little spikes as well. So you can imagine that if your body thinks that you're in danger, what is it going to do? Well, it's going to increase your heart rate. So now your heart has to work harder. It's going to increase your blood pressure to push more blood towards your muscles, like your legs. So therefore, your blood pressure is going to go up. And it's going to want to send sugar to your muscles, thinking that you need to go run. So therefore, it's going to increase the sugar in your bloodstream. Except you're not running. You're sitting in the car, or you're sitting on a Zoom call, arguing with your boss. And so all of a sudden, you're not using any of those resources. So now I just gave you high heart rate, high blood pressure, and high sugar. And so therefore, you're going to have high blood pressure and you're going to have diabetes and all those kinds of things. So perhaps our lifestyle is actually altering these things as well. Now, the cells are working very hard. So you can imagine your cells, your heart cells is working very hard. So I'm just going to show you some science that's relatively new. And this is the idea that you've heard about the blueprints, right? This is your DNA. That's sort of tells you how to make everything in your body. The way we use DNA is that we make a copy of it, okay, to send to the factory, okay, to make that protein. Remember, we're trying to make proteins. So we take this DNA and then we make an RNA copy of it. Okay, mRNA, you've heard that a lot. So you make a copy of it, and that's the one that you send to the factory in the cell to make the protein. Okay, so that's where you put the little amino acids and hook them all together. And then you can make your little protein, which is the whatever structure, your hair, or some enzyme that's doing a chemical reaction, or maybe a receptor or a chemical that you need. Okay, so this is how it's made. In a normal cell, in a healthy cell, when you're just sitting there, they estimate that you need to make 1,000 of those RNA copies, okay? So you need 1,000 of them to make all the proteins that you need for that cell. About half of them are destroyed every 30 minutes. Okay, in other words, these little blueprints self-destruct, so to speak, and then you need new blueprints. And that way, we always make sure that the blueprints are right. So that means you have to make about one of these blueprints every 3 seconds. So you could see that that's pretty quick. Now, if you have diseases or you start smoking or take alcohol, you have diabetes, high blood pressure, then your cells are working harder. And so therefore, it has to make more than one of these blueprints every 3 seconds. And so now this transcription, this RNA thing is faster. Now, as you make more copies of it and you're going faster, you're going to make mistakes. And when you make mistakes, you're going to now make a protein that's not right. And if the protein is not right, it cannot do its job. If the protein is not right and it sticks together, then you get the stuff in the Alzheimer's disease that we saw. If the protein is not right, it can't do the cutting. And now whatever that process is not going to get done. So therefore, is this the reason why we age faster when we go really fast, right? When you're stressed out and you're not sleeping, we age faster. Those people also have more cancers and things like that. I like this sign. Don't rush me. I'm making mistakes as fast as I can. So we don't want to push your cells to doing that. And this is a very cool looking picture. So you have a frog here and a horse here. And so are they the same? So turn the picture. So I decided to turn it for you. And you can see that it's two frogs. Okay. So my takeaway from all of this is, could these mistakes lead to aging and cancer? In other words, we push the system hard, they start making it really fast, they start making mistakes, and that's when we start getting aging, because now you can't repair. And is that why we also get cancer? Because you have all these defects, these defective proteins that aren't working properly. So my suggestion to you is to slow down, calm down, don't worry, and don't hurry. And then maybe add on top of that, eat well and sleep well. So perhaps these are the things that we need to do for ourselves, for our children, for the loved ones around us. Maybe that will be helpful. And I like this one very much. Your husband is suffering from a very severe stress disorder. If you don't do the following, he will surely die. Each morning, fix him a healthy breakfast. Be pleasant at all times. For lunch, making him a nutritious meal. For dinner, prepare a especially nice meal. No chores, no nagging. Oh, yes. And make love several times a week. Do this for the next year, and he will regain his health completely. Could you imagine doctor telling the wife this? And then the husband says, what did the doctor say? You're going to die. So basically, she's not going to do any of those things. So perhaps by not making it too complicated, if we can just say, let's just slow down, maybe that's the thing that we need to do, just like those people in the blue zones that they live well. And here's a label from clothing that's really funny. I never thought I'd show you this one. So it says here, remove child before washing. Okay, so I never thought I'd show you a label like this. So how do we make it simple? You know, I went through a lot of crazy stuff this evening. So how do we make it simple so we can actually do these things? Number one, those 8 things. Not hard, right? Diet, exercise, control your sugar, control your weight, control your cholesterol, blood pressure, no smoking, and get your sleep. And if you do those 8 things according to the American Heart, you will cut down on your chance of dying, not just diseases, but the chance of dying. And you can imagine that your machinery will work much better under those conditions. Keep those 5 senses going. In other words, keep the eyes healthy, keep the hearing, touch, and that way it keeps the brain sort of healthy as well. Keep an eye on your poop, right? Because we have all those, billions and trillions of helpers that are helping us. We need to make sure that the bowels are going well so that we can extract nutrients and things like that. And perhaps we should adopt this thing, So in other words, this slow down and so on and so forth may be what we need to do. And then hopefully that will mean live long and prosper, because then we will all be able to keep all our organs functioning well as we get older. And this was John F. Kennedy talking about his dad. And he said, don't just add years to life, but add life to those years. So I think that's very appropriate for us. We have an elderly population. We have a younger generation. Let's protect the younger generation. Let's help the older generation at the same time as well. Anyway, thank you very much for staying awake. And sorry I droned on for so long. Let me stop my sharing, and we'll turn things back over to Jeanette.
Thank you so much, Dr. Lin. Lots to think about. Yeah, great information, and presented in such a great way. I know I'm going to be re-looking at this presentation and learning more each time I do.
Great.